Hi, I'm Tiana. This is Annalisa. We are talking about an article by Emily Schroepfer that's called A Renewed Look at Faith Community Nursing. So really the objective of this article was to take a renewed look at faith community nursing and what it looks like today, also in comparison to its history. So faith community nursing is defined as, and I quote, the specialized practice of professional nursing that focuses on the intentional care of the spirit as part of the process of promoting holistic health and preventing or minimizing illness in the faith community. So the point that I really wanted to talk about that was highlighted in the article was the coordination of services that a faith community nurse provides. They do it before and after someone is hospitalized. There's actually a story in the article talking about how there was a man who knew a faith community nurse, and he needed to get a colonoscopy for just screening reasons, and he was really afraid of the pain and the prep of the procedure, so he refused to get it. The nurse encouraged and explained to him how the procedure worked and that he'd be asleep, and so he eventually agreed to get it done. And then they actually found several cancerous polyps that they were able to remove during the procedure and prevent hospitalization for cancer colon and surgery. So really nurses have a huge impact on people to keep them out of the hospital. They also have an impact on people after the hospital. The transition from the hospital for a patient can be very challenging. Patients often go home with venous access devices. They can have bandages or dressings or drains they really don't know how to take care of very well. And the short discharge education after leaving right before leaving the hospital sometimes is adequate. And so the faith nurse can really help because they are able to coordinate post-hospital care and prevent patient vulnerability. And actually a stat mentioned in the article is that they can increase adherence to medical prescriptions and reduce hospital readmissions by 23%. Also, they're just the ideal person to help coordinate services through the hospital, doctor's offices, nonprofit organizations, and therapists that can really just help these patients. They also mobilize the faith congregation to provide a positive, supportive network to the recovering patient.
Another point that the article discussed was the history of faith care nursing. Throughout history, a lot of communities have considered it their religious responsibility to care for and administer relief to the poor, the sick, and the elderly in their communities. And historically, members of the community without medical training took it upon themselves to fill this capacity. And in our own history of the Relief Society, we have a great example of this. The book Daughters of My Kingdom quotes, "The minutes of their meetings are full of expressions such as the following. Sister Joshua Smith went and visited Sister McEwen and Sister Maudley, found them and their families in suffering want. They need attendance every day. P.M. Wheeler would recommend to the charity of this society Sister Frances Lou Law, who is sick and without a home, an aged widow lady at present destitute of money. Sister Peck reported Mr. Guys and family are sick and destitute, administered to their relief. Miss Kimball stated a Mr. Charleston and family were sick, his wife very low and in great need of a nurse." In our day, we see the Relief Society performing similar cares for events such as births, deaths, and hospitalizations. And over time, people such as Theodore Fliedner, Mary Breckenridge, and the Reverend Granger Westberg founded schools specially designed to train individuals to function as faith-centered nurses in addition to their medical expertise. Today, there are specific requirements to become a faith nurse. You must hold a current active RN license, complete 30 hours of professional development requirements in faith community nursing in the past 3 years, complete 1,000 hours of faith community nursing practice in the past 3 years, practice 2 years full-time as a registered nurse, and then fulfill 2 professional development categories in the following: either academic credits, presentations, publication, or research, being a preceptor, or providing professional service. In conclusion, faith care nurses play an essential role in advocating for patients in communities of faith settings. The history of looking out for one another has really influenced the development of this aspect of the nursing profession.